Good morning, everyone. I am Nyahsa Makiriyado, and I'll be giving a presentation on how to give an actual presentation. A little bit about the formatting. It's kind of like a rough draft of how you might format your own presentation. So say you have your definition page. You can put your list of definitions without actually having a definition on the actual definition page. I would just have either note cards of those definitions so that you're not losing your audience. My definitions in this instance is going to be the agenda for the presentation. So we're going to go over symptoms, the diagnosis, treatments, and possible preventative care. Before we get into preventive care, I'll have a few examples of what to do in your presentation and what not to do, as well as how to utilize good presentation manner with your board questions. Another tip that I had for the definition side was whenever you are going through your definitions, you can have pictures or pick up something whenever that'll help you explain it a little bit better. So a picture of symptoms, or whenever you're talking about treatments, then you would go forth and have something about whatever your definition in particular is. So if you notice that your presentations have long sentences or paragraphs, have no pictures, no transitions or animations, a lot of complex wording or inconsistent formatting, your presentation is a sick presentation. For a sick presentation, there is a lot of overwhelming amounts of information. You don't want to have big paragraphs or long, you lose your audience. They become unengaged, and they can either become super confused because they may not have an in-depth knowledge of that information, or they become really bored and inattentive because what you're saying isn't necessarily matching what's on the board. The speaker is prone to loquacious tendencies. In other words, you begin to ramble. A lot of the times what is on our slide is not necessarily what we're saying to our audience. So you want to make sure that your slide has kind of like the bottom line of what you're actually saying, because you can use your slide to kind of give you pointers or different breaking points for you to expand on. So the treatment is less is more. You do not want to pull a Neymar when it comes to your presentations. Extra is not good in this instance. The guideline you should go by is 5 words, 5 lines. 5 words per line, 5 lines per slide. If it's more than that, you've done too much. You want to keep your audience engaged by asking questions, using humor whenever appropriate. When you know your audience, you kind of know how far in terms of your humor to go. In this instance, memes, I think, are perfect.
Memes are always perfect.
Yes, they are. There's plenty of them out there for
Yes.
me.
And then, of course, using transitions and animations. They're the most basic tool that's found on PowerPoint. If you want to use Prezi automatically has animations or really cool transitions already kind of set up within that programming. If you don't stick to the bottom line, you'll lose your audience. Your slide is essentially a straight to the point synopsis of the information that you have. If you have strong knowledge in your topic, this will not be a hard thing to do. If you're also someone who needs your presentation to kind of guide you, I recommend having like just a little sheet of information so that if you lose your spot or you get a bit confused, you can always just look down and it'll kind of help you. Another big tip is if you don't like it, your audience won't either. If there's a point in your presentation where you start getting engaged or you're bored, your audience will also mirror that. So whenever you are creating your presentation, if you're engaged throughout the entire time you're working on your presentation, your audience will be well. So in this instance, there was already something I've done wrong in this particular slide. Could anyone put?
5 words, 5 lines.
Yes. The last line is the 6th line, and it does not have 5 words. In some cases, that's okay, but I would stick to 5 words, 5 words. So here is an example of the acute coronary syndrome This is the pathology slide that a student did. One of the biggest problems already pointed out, formatting. It's really abrasive and it's hard to kind of see. So your audience is already trying to kind of figure out what you're going to be talking about. Another problem is how there's too many words. Although they did keep it under 5 lines, there's more than 5 words. And so your audience is going to be reading what you wrote and not necessarily listening to what you have to say. So the next slide will kind of be an example of how this can look, but in a way that will keep your audience engaged and will still communicate the information you want. So with this slide, you have a picture of what would be the myocardial blood supply and myocardial oxygen demand. You want to break it up into sections because this is a lot of information that they're going to be kind of taking in. So if you break it up into maybe sections of 3 or sections of 2, then you can kind of take your time in explaining exactly what that information is. Using pictures such as the one that you can see will help you give a visual to your audience. You want to keep that audio-visual connection throughout the entire presentation because then they can see what you're talking about and kind of relate it easily. So by breaking it up, you can easily talk about what an occlusion is and how that is used in the medical world. And then you can talk about the different ruptures and so on and so forth. So board questions are usually the hardest to do because you usually have the question and it's in the form of a case study. And a lot of the times it has a lot of information, but that information is needed. So you don't want to put it out in a way that might cause your audience to have the wrong answer or cause them to be further confused. So in order to continue with the 5 lines, 5 words, I would recommend using handouts for the case study that have the entire case study that you would read off of, utilizing slides to separate from the presentation. So I have an example that you'll be able to kind of see how that would look. Utilizing pictures. So in this instance, we're going to have a few examples. There's a picture that goes along with the case study that you can either put on the slide, which I didn't in this case. I have it as a handout. And then summarize a long question. So a lot of case studies will have a question at the end. You can summarize it to kind of fit that slide. Our first question, this would be an example of kind of how to break it down and show your audience that now is the time to be engaged. And you would have the question at the top of the slide, and then of course your options that you can utilize. So in this case, I have some handouts of the actual case study, and you'll also have your questions to look at. And we can take a moment to kind of read what the case study is. So a phlebotomist is called to the ICU to draw blood from a patient waiting for a bed in CPS. The nurse on duty has stated that the patient is calm and appears to have control of themselves. The patient willingly engages in appropriate identification procedures. Once the phlebotomist actually punctures the vein for blood collection, the patient unexpectedly jerks her arm away and pushes the phlebotomist so hard she staggers against a wall. What is the best choice for this phlebotomist? A, approach the patient again. That sample must be collected. B, activate the needle safety device. Since the needle is exposed and dangerous, then exit the room. C, make sure the patient has stopped bleeding, then exit the room. Or D, exit the room immediately. What would be the best answer?
B, I think.
Yes, B is the right answer. So then you proceed to kind of have an answer slide or just kind of say it out loud. The next handout I have is an example of a more, I guess, relatable way to do the question. You'll have the handout, which will have the question and the picture and the answer with it. And I don't have it on the slide, but this is just kind of a more in-depth example of what you can do that's more correlated to a presentation that you would actually give.
And that was done by one of the third years last year, Ashley Blanchard. So I was kind of hoping she was here so I could brag on her today too. She did a really good job with those questions. And then, no, we don't expect you to know the answers.
Yes, we do, Franz. You're expecting to know everything.
So what are some preventive care measures that you can use to kind of help you keep your presentation engaging and keep your audience engaged? One of the biggest tips I can give you is slow and steady wins the race. Speak slowly and clearly to kind of help your audience follow along. You're not going to have a lot of information on your slides, so they are going to be depending on you to break it down or explain it further, more in depth, because they are going to have an idea of what the topic is, but since this is a topic that you in particular researched and understood, you're the expert in this case. So you have to be able to utilize your expertise to teach others. Keep a clear, consistent layout. This is very, very, very important. If your layout is too abrasive, so don't use colors like red or yellow or really bright colors that might be distracting to the eye. Try not to use too many pictures in a slide. One and done is your best bet. Sometimes two is okay as long as it correlates with the information that you're utilizing in the slide. If you have a meme and then you have an informational picture, they're going to clash. So you want to make sure that your pictures are also consistent within that slide as well. Trying to maintain a font that stays throughout the entire presentation. So all my titles were 20 and the information was 18. And it's usually not that hard to make sure that your fonts are okay because it's kind of formatted within the design that you choose. But if you have various wording, such as paragraphs, or you kind of change where you want your words to be, they'll change the formatting to fit that box. So you want to be aware of that and just make sure that your layout is consistent throughout the entire presentation. Know your audience. If you are speaking with, audience that isn't necessarily your classmates, you'll have to understand where the professional line is. Your presentation needs to be professional. I would kind of double it back on the amount of memes that might be in your presentation. It is important to have humor because you want to break that ice. And then if you're not speaking with med students, looking at the type of vocabulary that you're going to use is important because you don't want to lose your audience with words that they may not understand. And if you do use a word they don't understand, explain it or try to kind of double it down in a way that they can understand. Most importantly, have fun and be yourself. Presentations aren't always the easiest to give, but if you put a little bit of your personality within the presentation, it makes it a lot easier and more comfortable for you as a speaker to present the information. And then if your audience sees that you're having fun and you're comfortable, they will also be fun and super comfortable and more engaged in the presentation. You are gonna meet audiences that aren't as engaging, and that's okay as long as you're having fun with it. So keeping activities or questions to kind of like a minimum, probably 1 or 2 per presentation or after every 4 slides or so. So yes, we can do a presentation that will keep our audience engaged. Do you have any questions today?